I'm esthetician Trish McCarty, and I received this comment asking me to go over what the laser does, because right now we're having a laser sale. The BBL handpiece, BBL Hero, that stands for broadband light, and what it does is it removes unwanted pigment. So it removes brown pigment, so like pigment from sun damage. You do not want to treat melasma with this handpiece. If you go to a provider that's trying to do that, you need to run, because this will make melasma way worse. I would use this for sun damage. Maybe someone has brown pigment in a scar that's superficial. That is what I would use this for, and that can be all over the body. It can be on the legs, on the arm, face. I will say the body gets a little tricky depending how old the damage is. They're coming in with sun damage that's literally 40, 50, 60 years old. That's much harder to get rid of than, let's say you've had it for 5 years. Anything that's been there for years, you gotta realize it's gonna take a series of treatments to remove it. It is layers deep in your skin and down into your dermis. And what this is doing is it's pulling it up and out and getting rid of it. In addition to removing brown pigment, it also removes red pigmentation. So let's say you have pigmentation that's red from rosacea. It will pull that pigment out and get rid of it. Now with rosacea, and it's an ongoing thing, you're gonna have to come in for maintenance treatments. It can also treat little telangiectasias and little broken capillaries that tend to be like right through this mid-face, and especially around the nose, so most people call them veins. It does treat that. Now, this hand piece that we have does not treat veins on the legs. We tend to, if someone has unwanted spider veins on the legs, we send them to our Marshall Vein Clinic, and Kelly Armstrong is amazing at injecting those and getting rid of it. So we just honestly refer them to her. This also treats cherryangiomas, so you'll see like little red dots on the face, typically on the trunk. Benign, you don't have to worry about them being cancerous or anything scary. It's just all cosmetic, unless it's like rubbing your shirt and irritating your skin, something like that. Technically treats acne, but I have had mixed results with the acne. I do very well with getting rid of unwanted redness and unwanted brown pigment. This is great for getting rid of superficial red scarring. So like if you had a biopsy, if you had a surgery scar, if you even just, I had a lady, you know, earlier this year who hit her head like right through here and had this big red scar, and it really bothered her. And after 3 treatments, it looked like nothing was there. So it's very effective if you get to the scar in time. Hard part for me is if someone comes in and the scar is like 20 years old. It's very hard to remove pigment once it has settled that long. It's not impossible, but it is going to take a lot more treatments typically to remove it than if you come in within 6 months from having the scar start. Also gets rid of hair. So you can do laser hair removal with this. And it doesn't, you can't treat blonde, white, or blonde hair. It has to have pigment. And real quick, I'll show you my little skin model. So here's the hair, and you would think, hey, I need to grow my hair out so you can laser it. But with our laser in particular, and this is why you have to ask the office you're booking with, we want it actually trimmed down or even like prickly. Like we don't want it fully grown because it's not going to be effective. Because what I'm trying to do is aim that laser to come down into the hair follicle and hit this, because that's going to destroy that follicle and keep it from growing back. But if I try to treat over hair that was literally this long, it's not going to be effective. So I have to at least trim it down, something. And a lot of people come to me because they get rashes and ingrown hairs when they shave. So they're like, well, what am I going to do? I can't shave, you know. That's fine. Like just take an electric razor and buzz it down. If you want to know about the halo, the profractional single spot treatment, watch my other video. I'm going to do 2 parts on this so that I can hit all of the hand pieces. Comment down below any questions you need clarification on, and thank you so much for watching. Bye.